So in this video, I'm going to show you or describe what the tooth death cycle is and what it traditionally is and how biomimetic dentistry can help break that cycle so you can keep your tooth for your entire lifetime and never be in a position where you have to have your tooth extracted prematurely. Okay, here's what we're talking about. We're talking about one day you go to the dentist, they find a small cavity, right? Well, that cavity in traditional dentistry, you get a filling done, right? So the filling over the years, they don't last forever. You can develop decay or cracks underneath the filling. And oftentimes it becomes symptomatic. Your tooth is hurting and you need a root canal. Once the root canal's done, conventionally, we would tell you we have to cap the tooth, and we cut down everything. We cut down the rest of your healthy tooth structure to put a cap on it, which you're seeing here. A tooth with a root canal and a cap, unfortunately, I see this happen all the time. You can develop decay again underneath the cap, and in that case you wouldn't even feel it because there's no nerve in the tooth. And maybe you've been told that, well, you can't save the tooth anymore, and unfortunately we have to extract it and replace it with something else. So how do you stop this cycle? Well, if you come to me here when you have a small cavity, I will keep it very, very, very small. I remove the minimal amount needed to bond it together. If you come to me here when you already had a filling and there's cracks and decay, again, we will keep it as small as possible using the most advanced techniques available today to stop the cycle. Of course, if you have an even smaller cavity here and it's super tiny, we can stop it right here. And we even have medications we can place to stop the cavity from growing to begin with. If you come to me already having had the root canal with no crown on it, then I can not put a full crown on it and can put a very conservative inlay or unlay on it depending on the situation. If you come to me here and you already had the root canal and the crown and everything, and they're telling you need it out, then I can try to save your tooth with another crown. It's already been cut down. But the key is to stop it really right here and slow down this process, okay? Keep it for many more years. Prolong this. Keep this from happening so you have your tooth for the rest of your life.